Hey everybody, this is John Oxley with Huntington Physical Therapy, doing my Friday tip of the week. Over the last couple of weeks, we've been highlighting some of our therapists and some of the conditions that they treat. Today I have Kelly Collier. She's a physical therapist that's been with us for 6 years. She's our foot and ankle specialist. A really common condition that Kelly sees is plantar fasciitis. So we thought we'd do a video today just talking about plantar fasciitis and giving you an idea of some of the things that you can do on your own before you seek any treatment from a doctor or physical therapist. So let's get right into it. What's a typical patient look like that comes in with plantar fasciitis?
So there isn't any textbook answer to that question. The patients I typically see are anywhere from ages 10 to 90, and it can be male, female, old, young. Typically, one of the big factors is weight gain. So a lot of times people come in and say they've put on 10 or 15 pounds recently. That can be because of pregnancy or just change in season or change in diet or exercise routine or stress. There are different life factors, but a lot of times that is a common theme that people will come in and say, recently this has happened.
What about foot type? There are different kinds of foot types. Is there one kind of foot type that gets plantar fasciitis or no?
Yeah, so there's sort of a spectrum as far as the foot has two jobs, and one is to be a nice rigid lever for push off, so to take a step, and the other is to be a good shock absorber. So the more mobility you have in your midfoot, the more hypermobile of a foot you have, and so that we call those people flat-footed. So there's the flat foot type, and then there's also what we call pes cavus, which is the high-arched foot that tends to be stiffer, and you can get plantar fasciitis because your foot is too hypermobile and loses strength or needs more strength. Or you can get plantar fasciitis because your foot is too stiff and needs more mobility to it. So the answer to that question is no, it doesn't matter what type of foot you have. And every once in a while you see somebody with a completely neutral foot that's right in the middle of that spectrum where you would typically want it, and they still come in with plantar fasciitis.
So there are a couple different foot types, but are there some just common, easy exercises that people can start at home if they feel like they're starting to get some plantar fasciitis?
Absolutely. So usually I have people start first with rolling their foot over a ball. I have them start with a tennis ball. It's a little more forgiving, or you can use something more rubbery like a lacrosse ball. But this is the hard part because I always tell people it's no pain, no gain, because especially at first it's very tender. So you want to find the tender spots and roll over them. As time progresses, they should get less and less tender, but at first it's definitely very painful. So you want to do that for about 5 minutes, and it'll kind of desensitize the tissue and also warm it up. And then once it's warm, you're ready to stretch. So you want to work on mainly stretching the calf. So the typical runner stretch where you lean up against a wall to stretch your calf. And then the second is to stretch your foot down the other direction also. Depending on which one's tighter is the one you would focus on more. But you want to work on each of those for about 5 minutes, a couple times a day, and see where that gets you.
Now, a lot of people can look up those videos on YouTube or have seen those exercises. Let's say they're doing them and they say, you know what, it's still bothering me, it's not getting better. What can you offer them in the clinic that may be more or different than just those exercises they're doing on their own?
So once you've started that basic stuff and it's not really helping, or it's helping a little bit but you feel like you need something more, you can absolutely benefit from a more in-depth evaluation of your foot. There may be something, a smaller region of your foot that needs a lot of focus as far as manual mobilizations go. We also have a technique that we use in the clinic a lot for plantar fasciitis called Graston. We use stainless steel tools that look a lot like a butter knife but aren't sharp, and sit and manually mobilize those specific areas in the tissue that are filled with scar tissue and try to break that down manually. We also have a class 4 laser here in the clinic that we use a lot on plantar fasciitis that seems to be beneficial.
A lot of people wonder about footwear. Is there a good type of footwear for this problem or to prevent it, and are there bad types of footwear that people need to avoid?
So that's another time you see an upswing in plantar fasciitis in the clinic is when you go from wearing, say, a work boot or even a dress boot that has a little bit of a heel in the winter, and then the weather gets nice in the spring and we go to like these Toms or Bobs, these little flat shoes or a sandal, because you go from having your foot in a little bit of a heel lift position to being completely flat. So that puts more stress on the tissue. You just want to be aware of what you're wearing. A lot of people do barefoot running or really light footwear, and as long as that's what you're used to, then that's fine. But you got to watch for extreme changes. You can't go from wearing this big lace-up sneaker all the time to flip-flops all the time, or you will typically run into problems.
Okay. Well, hopefully that was helpful. Learn a little bit about plantar fasciitis. If you have any questions or comments, feel free, call the clinic. Kelly would be absolutely happy to talk to you a little bit more about it. You can send us questions or comments on Facebook, and we'll see you next week. Thanks.